Good evening, everyone. This is Beverly Buncher, and we're here for International Overdose Awareness Day. And this is the world's largest annual campaign to end overdose and to remember without stigma those who have died from overdose and acknowledge the grief of the families and friends left behind. The IOAD 2023 theme, Recognizing Those Who Go Unseen, is about acknowledging people in our communities who are affected by overdose but might go unseen in the crisis. The emphasis tonight is on first responders. So just to give you some current as possible statistics on overdose, 2021 saw 107,000 Americans lose their lives to overdose. And the 2022 numbers are estimated to be higher than that. And rural areas account for nearly 40% of the overdoses in this country. Those are some really awful statistics. And yeah, I think it calls for a moment. Just let it sink in. And as we honor first responders tonight, we don't want to lose sight of the hundreds of thousands of family and friends who have been affected by this epidemic. And, I believe that we're talking opioid epidemic, but there are so many different overdose epidemics in this country. 90,000 people die a year from alcohol overdose and another almost 100 for meth. I mean, it's just enormous, the number of people who die from overdoses of drugs and alcohol. So again, this year's theme is recognizing those who go unseen, honoring the first responders. And we're very honored tonight to have Carson McCord, a current EMT, and Lisa McDonald, a BOLM coach and former EMT, on our program tonight. I'll let them tell you a little bit more about themselves in a few minutes. Our schedule for the evening will be they will share their experience as a first responder as it relates to overdose, and then we'll open the floor for questions and reflections, and we'll close with a moment of silence for those who have lost their lives to overdose. So I'd like to first introduce Carson. And Carson, could you tell us your full name, where you live and serve, and what is your capacity as a first responder?
Yeah, my name is Carson McCord. I live and serve in Salt Lake City, Utah. And I am an emergency medical technician for an ambulance company that kind of is contracted and partnered through the Salt Lake City Fire Department. And so we facilitate all of the 911 calls that end up needing to be transferred to our ambulances. And so, yeah, so my capacity, I am an EMT. Yeah.
Say that again, the last sentence that you said.
Oh, I am EMT.
You are an EMT. So yeah. What led you to the work that you do, Carson?
Yeah, so I believe that what led me to be an EMT and to work in EMS in general, I had worked previously for 2 years for a wilderness therapy program, and with myself also having gone to treatment and worked in wilderness therapy. And so that for a while, kind of therapy and the emotional aspect of helping others was a big part of my life for about 4 years. And so I decided that I still wanted to reach people and help people, but I wanted to change the mode in which I am able to do that. So I kind of went from the emotional and the mental support to more of the medical approach.
Mm-hmm.
And so that's what got me into it. And I've been working in EMS for not that long, only about 6 months now. And I went to school and got my EMT certification in January of this year. Yeah.
Yeah. So you said that you moved from sort of the emotional to the medical. Have you found it to be just medical, or have you found an emotional aspect to your work?
There's definitely an emotional aspect to my line of work currently. Both within myself, I think there's a lot of emotions personally that are tied into the job I do. But then, with the society we live in this day and age, a lot of the patients I work with on a day-to-day basis are of, needing transport, and that's why I'm there as like an
Mm-hmm.
EMT, but are in need of more psychiatric and emotional support as well. So it's kind of the best of both worlds.
Mm-hmm. Mm-hmm. It's funny. As I'm listening to you, I'm thinking back on EMTs that when I've been in emergency situations, either because I needed it or a relative needed it, and how the EMT is like, this is how I feel. I don't know why it's coming out, but it's like that person is like a rock. You feel like your world's falling away from you. And there's this person with calm and love and care and just, have you noticed people looking to you in that way?
Yes, yeah, 100%, and that's one of the big things that they teach us, when we are getting our EMC certification, is that, like, um, they say, like, okay, you're gonna see a lot of concerning stuff, a lot of gory stuff, scary stuff, but ultimately it's not your emergency. We are there responding to someone else's emergency, whether it's a family's emergency, um, a loved one's emergency. That is their emergency, and we are there to show up and do our job. And especially with our uniforms on, more often than not, we are the ones on scene that when we arrive, we bring that calm and that relief for whoever is going through that emergency or that crisis, and whatever it may be. We show up calm as can be, ready to do our job, and that tends to be very relieving and calming for those who are enduring that emergency or that crisis or that specific situation.
Mm-hmm. And have you ever had to administer Narcan to revive a person from an overdose in your job?
So like I said, I've only been doing EMS for about 6 months now. So I personally we carry plenty of doses of Narcan on our ambulances because of how common it is. But I personally have not had to administer Narcan, but I have been on multiple scenes where I see firsthand that Narcan is being administered.
Mm-hmm. Mm-hmm. What's it like to see that?
It's definitely, and specifically with my history, I would say personally, it's definitely an emotional experience, not only for first responders and EMS, but specifically for I guess the patient or the loved ones of the patient, the family, the bystanders. It definitely is a heavy situation, but as EMS and being a first responder, um, we are trained to not, we try not to show those emotions because it isn't our emergency. And we are there to like, we are who they call when they're in their emergency. We show up professional, calm, And that kind of, because it wouldn't be a good thing if the people you call in your emergency are also,
pull apart with you, right?
right, yeah. And so it's definitely, I think, in the moment, you know, and with the training you have, you're showing up professional. You're doing what you can. But I think more on the backside of that, like after that call is over, or after you leave scene, I think is where those emotions really come in, and it definitely can be scary. And I promise you that it is a scary um, situation for EMS providers as well. It definitely is. Um, we're just kind of we try to maintain those emotions until after the
Right.
call, after the day.
Right. So do they provide a way for you to deal with your emotions? Do you have support in your company or?
Yes, yeah, that's a great question. And I think um, that's something in which I don't think is talked about enough, but we're slowly getting to that point. Is the mental health and almost like PTSD or for
Mhm.
emergency responders.
Mhm.
And so my company that I work for, we offer I think the community within itself and your partner or my partner and who I work with, I think like it's kind of an unspoken rule that like you are supporting each other physically, mentally, and offering advice and that support. But we also offer a more formal form of support. Um, with that being, it's I think it's called EAP, and it
Oh,
stands for Employee Assist Program, where
uh-huh.
we have access to um, uh, therapists or social workers to debrief certain scenarios or things that are we find that are causing longer lasting mental health um, issues or problems related to specific calls or multiple calls. um, and so we do have that, and my company does offer that. And with that being said, it's not, and with mental health in general, it's not always that easy to be able to speak about those things. So they offer it, um, and that's kind of upon the individual to take that
Mhm.
opportunity to
Mhm.
um, yeah, kind of process their way through that. And like I said, that's easier said than done. And I fortunately have only been doing this for 6 months, and I um, haven't found or seen or been a part of anything that's too crazy. Um,
Mhm.
but there's EMS workers, first responders, police officers who've been doing this for much longer than I have, and over time it weighs on you for sure.
Mhm. I would imagine. Is there anything else that you would want to share with the families about any of your experience with this, particularly as it applies to overdose?
Yeah, yeah. So um, I'm not sure who all knows who I am, or maybe are familiar with my mother. Um, but she's always telling me, um, and she would say it's a blessing, but I personally um, I'm a recovering addict, and I had a lot of problems with substance abuse in my adolescent years. And I, metaphorically and in the literal sense, am an open book. Um, and so I myself, my mom always mentions it to me that it's a blessing that I um, I actually had an opioid overdose um, in 2018. I believe it was 2018. and in which I had to take a ride in the back of an ambulance to the hospital, and I was in the ICU following that overdose for quite a while. Um, and now I'm riding in the back of the ambulance, supporting those who are going through similar situations, offering, that calming support for families who have to endure that for a loved one. And so it is a blessing. And I think for those families out there, I think there's always hope. Um, and I think when it comes to addiction and the opioid epidemic, I think like it takes work, and for those families who have loved ones suffering, um, it's not something that can happen overnight. For me, I'm almost 4 years sober now, um, and it's taken those 4 years to solidify um, my my happiness and gratefulness that I have found in recovery. Um, and for me, that overdose was, thank God that I had came through that, because that overdose was my rock bottom, and was the last straw, you could say, that kind of woke me up and um, offered me a very hard experience, not only for myself but for my mom, my dad, my family, and my loved ones. Um, but I was able to grow from that experience, um, never forget that experience, but build on that experience to be where I'm at today, to be able to respond um, to calls in which I have personally been in myself, and offer that support and that calming factor when I show up on scene, and I'm able to do my job, along with those who are with me, my partner, um, PD, fire, um, and so I am super grateful, and there always is hope, um, and so that's kind of my spiel. I'd like to offer that background. But
Yeah,
yeah,
that's amazing. It's so gives us so much hope as family members to know that there is hope, that recovery happens,
yeah, yeah,
and that if someone lives through an overdose, it can be the rock bottom. And then they can come back. You were very fortunate to have a mom who was recovery savvy. Today, of course,
yes.
she's a balm coach, and she's not only recovery savvy, she's been helping families for years. Now she's also a balm coach. And what would you say if a family is listening to this and they're not yet in the balm, right? They're not in the balm, and they really, I mean, I can't tell you how many stories I hear, and I'm sure you see it, of families who take their loved one into the emergency room. They have an overdose. The loved one says, but they live. I'm fine. I want out of here. And the family just goes along with it. So,
Yeah.
what would you say to a family? What would you say to the person who has an overdose? What would your advice be?
Um, yeah, ultimately, that's a tough question, and um, I would say just never give up on offering that loved one resources, offering them opportunities, unconditional love, and that doesn't mean that there's no boundaries, right? There's always got to be boundaries, especially within addiction. Um, but like, not to give up, because in my addiction years, I would probably say that um, the stints that I spent in rehab, and then out again and then back again, um, I would definitely say like what my mom was doing, I can say now, was unconditional support, and not, I think, also on top of not knowing what to do, so trying everything. Um, and I think that loved one who is in active addiction will see that as annoying, nagging. You're riding their back. like leave them alone. I used to say that a lot. Just leave me alone. And for parents, it's not that easy. Don't give up, because my mom was persistent for 4 years, and I can say to this day that I am grateful for everything that she did for me. Whether that's dragging me from a friend's car while I was using substances and taking me to the police station, to financially supporting my wilderness therapy, and ultimately just always trying anything that she could, because it's the reason why I am here today. And they won't see that, and I can promise you that they won't see it as that way in the moment, especially because the last thing an addict wants when they're using or they're in active addiction is to stop using. But I do believe that especially if it's an adolescent, any stint of sobriety or abstinence that you can give them, whether it's, for me, a lot of times it's forced rehabilitation or like, I think is beneficial. And it's a hard line, because they are adolescents and they don't have any say over that. But like those forced stints of sobriety and abstinence ultimately saved my life until I was able to, as an adult, make the decision of this is what I want in my life. And I also, so just be persistent, and because ultimately I think with addiction, like the addict or the loved one struggling with substances, they're not going to change unless they're ready to change. And when they're ready, and then when they've hit their rock bottom, and that might be a while, like that's on them, like you're going to want to be there to offer that support. And like I said, that doesn't mean there doesn't have to be boundaries, because boundaries are way important as well. And then you said, what would I say to that individual? I don't know. I would say, like, those individuals that are struggling with substance abuse, or in this case, like opioid use, there's always a reason why. And I think that's the most important point. Why? And maybe ask yourself that, why do I feel the need to use? What am I trying to shy away from? What am I trying to numb myself from? And I would say just keep going strong, whether it's you're using or you're in recovery and you're sober. I wish everybody love and support, because that's what I received. And I just want everybody to know that they are loved and they are supported, and they are not judged by their actions, and that it is something that takes time and you have to be ready to do, and it's not an easy decision. But it's in my perspective, it's once you arrive there, it's a great decision, and it's changed my life. And I'm grateful for all the support that I've received, and I'm grateful that I got to that point before it was too late. So,
thank God. We're grateful too, Carson. We know you have helped and will help a lot of people. And I don't know about you, Lisa McDonald, but I'm thinking we need to recruit Carson as a ball coach.
I could get behind ball. I could.
So
like
Lisa
I said,
will
like
be calling you.
Yes. Yes. I will.
In honor of your mother, we're reopening our recovery facilitators program for people who want to work with the person in recovery. I didn't tell you this, Lisa, but Dawn McCord has been emailing me, texting me, calling me about getting this going. And as a result, Dawn, I'm emailing Lisa, calling her, texting her because she's our curriculum person for this program.
Mhm.
So it's just a matter of time, son.
Yeah. And that's my mom, persistence. When
Yes, she is
she,
persistent. She is
yes,
persistent. And
and
she
very
wasn't doing
passionate.
it to get you to do this. She wants to do it. So we'll see.
Yes,
Maybe it'll be like the Wrens. We'll have a mother-son partnership going here before we know it. We
I'd
have
love it.
we have lots of families where there's a mom or dad who are coach, and then they're either like Lisa's husband. Lisa's a coach. Her husband's a coach. And we just have a lot of families where they band together to bring this to more people. So that's cool. That isn't what we're here to talk about today, but it came up. Thank you
Yeah.
so much, Carson. We're going to have Q&A. We're going to put you back in the top little bubble up there and bring Lisa down. And then
Okay.
I'm sure we'll have
Yeah.
lots of questions. Wonderful to speak with
Yes.
you.
Yep. Thank you so much for having me. I appreciate it, and I love these moments. And I've done a few talking stints, but I'm always grateful to pass on my message and share. So I appreciate the opportunity.
We love it. We love that you're here. Thank you. And
Yeah.
don't go
Thank you.
away because I'm sure people will want to talk to you.
Awesome.
Okay.
Awesome.
Thank you. Okay. Thank you, Joan. And I'd like to now welcome Lisa McDonald. Lisa is one of our balm coaches and a facilitator and oh my goodness, she's going to tell you all about herself, but she's an important member of the balm community. So Lisa, could you tell us who you are, where you live, where you served, and in what type of position as a first responder?
Sure. So my name is Lisa McDonald. You told him that. I currently live in York, Pennsylvania, where I served as a first responder was in Anne Arundel County, Maryland. And I served as a firefighter, as an EMT, and then also as a paramedic. And then once I was a paramedic, I worked in Anne Arundel County, but I also worked in Baltimore and in DC.
And what's the difference between an EMT and a paramedic?
So an EMT, a paramedic is an EMT, but there are different classes of an EMT. There's an EMTB, which is basic life support. And then there's an EMTP, which is advanced life support. So, what each person can do is a little bit different.
And how old were you when you started in this field?
I was 16.
How did that happen? How on earth did that happen?
So it's interesting because I was in active addiction. I was 16 years old. And I had grown up in a community where I lived before I lived in Maryland. I lived in Pittsburgh, Pennsylvania. And it was just kind of a thing that people did. They just volunteered because there was no paid ambulance service. And there isn't here in York really a paid ambulance service, a little bit, but everything in Pittsburgh at that time was volunteer. So I knew a lot of people who were volunteer firefighters as I was growing up, older brothers and, so on and so forth. And so when I was old enough, I was at that point living in Anne Arundel County, Maryland. And it just made sense to me to join the fire department. It was always something that I just figured I would do.
Mm-hmm.
And I started as a volunteer. And at the time, at 16, I could ride the fire engine, put out fire. I wasn't allowed to go inside of a burning building, but I could serve on the outside. And at 17, I was able to get my EMT and ride ambulance calls at that point. And by the time I graduated from high school, I was a rescue technician, volunteer firefighter, volunteer EMT. I drove all the emergency vehicles, and I was also very busy getting high, which is terrifying if you think about it.
It's really terrifying on so many levels.
I was in active addiction, what I would consider my own active use, right? But mostly what that looked like at the time was binge drinking on the weekends with the guys from the firehouse.
Oh, okay.
There's a lot of drinking in the volunteer fire departments. It's a thing.
Wow.
So what else did you ask me? How I got started?
No, so tell us, like, so you kind of told us what led you to the work. It was just being surrounded by people. What made you move from firefighting to emergency medical?
In the beginning, I just wanted to get all of the training that I could. And when I finally went to get certified as a paramedic, at that point I was clean. So I took a sabbatical from my volunteer service when my addiction really took hold. And I guess that would have been like the summer after I graduated from high school. And I got clean when I was 20. And in that time period, I went from this kid that was like binge drinking on the weekends and serving as a volunteer to 85 pounds, meth addict, facing felony charges in New York City, basically just a disaster. And that for me was where my recovery choice happened. And so I chose recovery. And I pursued that. And I also pursued boys. And so very quickly after I got clean, I also got pregnant. And my parents loved me very much, but didn't have any interest in raising a grandchild. And so they said, we love you and we hope you find somewhere nice to live. So I needed a career.
So you were living with them and they kicked you out because you were pregnant.
Yes. So I needed a career. And so let's see, I found out I was pregnant in February. I turned 21 in April. I celebrated a year clean in May. I moved out of my parents' house the beginning of June. And then, I had a job, I was working, but it wasn't going to be something that I could support a child on long-term. So I was like, I need a career. I was back in the fire department at that point, volunteering. And so it just made sense. I wanted to work in the fire service. And at the time, there was a big push in Anne Arundel County for firefighters to also be cross-trained as paramedics. And they were putting paramedics on all the fire engines to improve response times. And so I was like, all right, well, I'll just go do that. And then I'll be able to get hired in the fire department. And so that's what I did. And it took me about a year because at the time now it's a college degree. You need an associate's degree now, but it wasn't then because I'm considerably older than Carson.
Not so bad. What are you, 29?
Exactly.
I'm 30, so I understand that.
That's right. So I got my certification, and what happened at that point was I graduated top of my class. I was blowing everybody away in interviews for all these different fire departments. I applied to every fire service in the state of Maryland. I was almost hired by 2. But what stood in my way every time was that I chose to be honest on my application about my drug use. And so I didn't get hired. And so I went into private ambulance work where I was doing critical care transport of complex cases, like from hospital to hospital with, ventilators and IVs and all of this. And that stimulated my mind. And that I really loved because I'm a learner.
Wow. So in that work back then, did you come across overdoses and
that would have been in the 90s. And so where I lived in the 90s, I mean, that was back in a time where you would hear old heads say, I've been shooting dope for 20 years, but it was crack that brought me to my knees, right? Because at the time, heroin was not what it is today. And not to say that people didn't overdose at the time. I was trained to use Narcan. Narcan was not a nasal spray at the time. So we were trained as paramedics, not as EMT basics. Firefighters couldn't do it. EMTs couldn't do it. Police officer couldn't do it. Nobody could do it because it was either an IM injection, an IV injection, or an IV infusion. And that's how Narcan was developed.
Wow.
And so I was trained to use it, but I didn't ever come across a need to use it because of the fact that it was different then.
Right.
I have used it since then because I'm also a woman in recovery. I've been in recovery for 26 years. And overdose is just part of my life. I carry Narcan with me everywhere I go. I've carried it for as long as it was allowed to be carried. And I've lost people that I love dearly and people that I have known for, at some points, like 20 years, who struggled and struggled and struggled. And when fentanyl hit the scene, it was just like everybody started dying. So as an EMS provider, that wasn't part of my story, but as a person in recovery, it is.
And do you think that you came across it more because you had this training so people would call you in? Or how did you, I mean, you're in recovery. Where were you coming across all these overdoses?
So in the times that I have had to administer Narcan, it's been something that, either it was because, of course, now I'm a balm coach and I have done transports, to treatment centers, for example, taking somebody who is still using to a treatment center or, at a recovery house or at a recovery event or things of that sort, because I'm constantly surrounded by people who are new to recovery.
Mm-hmm. Okay. Wow. Wow, wow, wow. So what is it like to administer Narcan?
I mean, I would actually kind of echo a lot of what Carson said in the moment. So once you have that EMS in you, it's always there. And I think it's because it's a certain kind of person that's attracted to this work, whether it's first responders, police officers, firefighters. You really have to compartmentalize. And, so when there's any kind of emergency, whether it has anything to do with overdose or not, I switch on and I'm in provider mode. And it's like the training kicks in and everything it's almost like tunnel vision to some degree. Like everything else kind of goes to the side. And I go into provider mode. And I don't remember feeling in the moment fear. I think for me personally, I'm really good at compartmentalizing because I'm also, that was my first drug of choice.
Right.
Is to compartmentalize. And so I know how to turn off my feelings, but it is the aftermath. It's after the event, it's the debrief, and for me, it has been the cumulative impact of overdose, and not just overdoses that I've witnessed or been a part of, but the fact that I've lost so many people that I love. And because I know I have walked my friends through them losing people that they love. It is really just a cumulative impact of grief. And it's kind of just always like right here for me. And I try to focus on the living and the hope, because where there is breath, there is hope. I will never stop doing this work, whether I'm getting paid for it or not. I will never stop fighting and advocating for the recovery community, whether I'm getting a paycheck or not, because these are my people. This is my community, and my community is dying. And it is hard. I don't go to all the funerals anymore. I am more selective today about the situations that I put myself in because of the emotional toll that it takes. And I've also known firefighters, EMTs, and first responders who have no longer been able to do this work because of, for example, PTSD taking over. I mean, suicide is the leading cause of death among first responders.
Interesting.
And it's so first responders are the highest, like if you look at demographics of suicide, first responders and police officers have some of the highest suicide rates of any other demographic.
And do you think that's because of PTSD, untreated grief? Or what? I mean, what do you attribute that to? Or has there been any studies on it?
It's a very high stress profession, and they get paid peanuts. So there's stress in the professional life, there's stress in the work life. It doesn't lend itself well to being present for a family. So all areas of your life is stress. And then you add on top of it the trauma of situations and circumstances. And for years, it was taboo to talk about it. So when I was in the fire department, there was no therapy or debriefs or any of that. You just, you know, you make a joke, you motor on.
Soldier on, yeah.
And so, you know, it is different now. I think that the industry, the community is more aware of the need for it now.
Amazing. So how did you move forward, and how do you move forward from these traumatic experiences that you have been exposed to again and again?
You know, I have a lot of joy in my life, and I try to focus on that. It's hard sometimes because I live a stressful life. I mean, we all do.
Yeah.
But it's like, I know the reality of overdose. I know the reality of what, like, I can see what 107,000 people looks like. And I've been clean long enough to know what it was like. I knew one person who died of overdose for the first 15 years of my recovery. One person. And then starting in 2014, it was person after person after person after person. And so I saw the shift. And so I have the perspective of knowing that recovery is possible. Recovery is beautiful. It is hard. It is not easy. It is not just about like pull up your bootstraps and make a choice. Like, it is hard. And I see with the clients that I work with who have opioid addiction in the last 5 years where fentanyl has been a reality, it is way harder for them. There's something about the chemical makeup of fentanyl that makes it so much more challenging to overcome. It just is. And so how do I move forward? I focus on the one person who's standing in front of me that I can help. I focus on helping other people learn how to help other people. And I do what I can do. And I take care of myself. I've had to learn how to take care of myself. And I used to go to all the funerals. And I don't anymore. Not because I don't care, not because I don't want to be of support, but because I'm no good to anybody if I'm not okay for me. And so I've learned how to take care of myself in a way that allows me to continue. So I know that I need times of retreat. I turn my phone off. I don't answer the phone calls all the time. Like I used to say, no matter what, I'll always answer the phone. But I can't be okay that way. And I can't carry all of that weight, right? So I've had a lot of therapy. I continue to work hard on my own mental health. Grieving is a process. And when you grieve and then you don't have anything else to grieve, it can be a process that kind of does have to some degree a conclusion. But when you grieve and then you have to grieve again, and then you have to grieve again and again and again and again, it just takes a toll. And so as I've recognized that, I've had to be more careful about all of those things. I don't know if that
Yeah, it really makes a lot of sense. And there are some balm coaches here tonight. And, as a balm coach, I work with a lot of families and I see what they go through, especially when they first get into the balm, of trying to figure out how to stop enabling, how to set boundaries, how to use leverage, how to not be their loved one's solution 24/7. And the stress of working with them and seeing that can be enormous. So how do you, as a balm coach, handle that? And what advice would you have for other balm coaches who might feel overwhelmed by what they're seeing, what they're experiencing with families?
Everything that we teach our families to do as balm coaches, we teach our families to, have a mindfulness practice, to practice self-care, all of those things that we're very busy teaching our families that they need to do, we also need to do for ourselves. And I think the answer to how do you move forward, it's always going to be self-care. It's self-care and boundaries, and healthy practices for dealing with emotion, knowing when to step outside and say, okay, this is bigger than what I can deal with. I need help. And that is sometimes the hardest thing to do and to recognize, especially as a professional, whether it's as a first responder or as a balm coach or as a therapist, we are the people who are there for the other people. It's sometimes really hard to realize when we need to reach out and find somebody who can be there for us. But I will tell you that even as we've been having this conversation, I got a message from another balm coach who knows me that just said, I love you. And so we have the opportunity to support each other. Community and support is also super
important. Very important. Well, Lisa, thank you so much for sharing.